Let's talk about macrosomia. LGA, birth weight 90th percentile. Macrosomia is a growth beyond a certain poundage, either 4,000 or 4,500 kilos or grams. 8% of all live newborn with more than 4 kilos. 1% weight 4.5, and 0.1% over 5K. Risk factors for macrosomia: constitutional, pre-existing gestational or gestational diabetes, regardless of birth weight. These patients have an increased risk for shoulder dystocia, clavicle fracture, and brachial plexus palsy. Pre-pregnancy obesity, excess gestational weight gain, abnormal fasting or postprandial glucose. Fasting is more strongly associated with macrosomia. The risk is about 2 times even with treatment. Dyslipidemia, prior macrosomic baby more than 4 kilos. This is the strongest risk factor. Postpartum pregnancy, post-term pregnancy, risk of 4.5 kilo baby is 1% at 39 weeks and 3% at 41 weeks. Multiparity or gram multiparous, male fetus and tall mom. Risk associated with macrosomia. Higher rates of C-section, postpartum hemorrhage, chorial, 3rd and 4th degree laceration, 10% chance of shoulder dystocia when it's 4.5 kilos. If you have gestational diabetes, or if you have diabetes, it's 30%. Most common fetal injury: clavicle fracture, brachial plexus nerve damage, C5, C6, Herb Duchenne palsy, 90% it will resolve by age 1. Other risks: depressed 5-minute Apgar, hypoglycemia, ARDS, polycythemia, macronial aspiration, increased NICU stay for more than 3 days. Ultrasound has a 15% error for 4.5 kilo babies. The positive predictive value is about 40%, and the negative predictive value of the ultrasound is 90+%. Effective prevention exercise, and for BMI greater than 35, bariatric surgery before pregnancy does decrease the risk of gestational diabetes. Suspected macrosomia is not an indication for induction before 39 weeks. 5 kilo or 4.5 kilo with diabetes, these patients we can recommend C-section, but must discuss with patient the inability to estimate birth weight accurately, low incidence of brachial plexus palsy and shoulder dystocia. Brachial plexus injury is not eliminated even with C-section, but it is reduced. During labor, these patients have a prolonged first and second stage. Prolonged second stage or arrest of descent in the second stage with 4.5 kilo fetuses before +2 station. This is indication for C-section. Increased risk for shoulder dystocia with assisted vaginal delivery. 5 times risk. So I think the most important is 10% chance of shoulder dystocia when it's 4.5 kilo, but if you have diabetes, it's 30%.